You've saved $1 million for retirement. That's it, you're set, right? Wrong. There's one expense that catches most retirees off guard, and it can quietly demolish your savings if you're not prepared. I'm talking about healthcare costs. And no, I'm not exaggerating when I say this could be the most important retirement video you watch. Retirement planning usually focuses on the big three: how much to save, when to retire, and how to invest. But there's a fourth variable that most people completely underestimate: healthcare costs. Here's the uncomfortable truth. Even with Medicare, healthcare in retirement can cost hundreds of thousands of dollars. And it doesn't just affect your health, it can force you to make difficult choices about where you live, what you spend on, and whether you can help your family financially. Let's break down the real numbers so you can plan accordingly. First, the baseline costs. Even if you're healthy in retirement, Medicare isn't free. Part B has a monthly premium that adjusts based on your income. For most retirees in 2026, the standard Part B premium is around $185 per month. That's over $2,200 per year just for Part B. But wait, there's also Part D for prescription drugs. The average Part D premium is around $40 per month, adding another $480 per year. And don't forget the roughly $100 per month for Medicare supplemental insurance, commonly called Medigap, which comes to about $1,200 annually. So far, we're looking at about $3,880 per year in Medicare premiums alone for a relatively healthy retiree. That's the baseline just to have coverage. Now add in out-of-pocket costs. Even with good coverage, you'll pay co-payments for doctor visits, co-insurance for procedures, and deductibles before insurance kicks in. A reasonable estimate is another $1,000 to $2,000 per year for someone in good health. The average healthy couple retiring at 65 will spend somewhere between $350,000 and $550,000 on healthcare throughout retirement, even with Medicare. That's according to government estimates, and it assumes relatively good health and no catastrophic medical events. Next, let's talk about the cost of chronic conditions. Here's where things get expensive. If you develop chronic health conditions like diabetes, heart disease, or cancer, costs can escalate dramatically. Let me give you a real example. Diabetes affects millions of Americans, and managing it involves regular doctor visits, medication, and supplies. Even with good insurance, out-of-pocket costs for diabetes care can easily run $3,000 to $5,000 per year. Heart disease is even more expensive. Bypass surgery can cost over $100,000, and ongoing care for heart conditions involves regular specialists, medications, and monitoring. Even with Medicare, you could easily spend $10,000 to $15,000 per year out of pocket. Cancer treatment is another major expense. While Medicare covers cancer treatment, there are still significant costs for co-payments, experimental treatments, and travel to treatment centers. The financial burden of cancer can be devastating, even with good insurance. And remember, Medicare doesn't cover long-term care. If you need help with daily activities like bathing, dressing, or eating, you're looking at potentially $7,000 per month or more for a nursing home, or $5,000 per month for assisted living. These costs can last for years. All of these factors can impact your retirement timing. Healthcare costs might be the factor that determines when you can actually retire. Many people plan to retire at 62 or 63, but Medicare doesn't start until 65. If you retire early and lose employer insurance, you'll need to pay for coverage either through COBRA, the Affordable Care Act marketplace, or simply pay out of pocket until Medicare kicks in. This gap can easily cost $10,000 to $20,000 or more, depending on your health and family size. The Affordable Care Act marketplace, often referred to as Obamacare, offers subsidies based on income, which can make early retirement more affordable. But navigating these subsidies and understanding your options adds another layer of complexity to retirement planning. One strategy some people use is to keep working part-time past 65 to maintain employer insurance while transitioning to Medicare. This can help bridge the gap, but it's not ideal for everyone. The best approach is to plan for more than you think you'll need. A common rule of thumb is to budget 4 to 5% of your retirement savings for healthcare costs above what Medicare covers. So if you've saved $1 million, plan for $40,000 to $50,000 specifically for healthcare. Let me make this concrete. If you're a couple with $1,500,000 saved and you're planning for a 30-year retirement, budget $75,000 total for healthcare above Medicare. That breaks down to about $2,500 per year, which might seem like a lot, but it's far less expensive than the alternative. Another tool is a health savings account, also called an HSA. These accounts offer a triple tax advantage. Contributions are tax-deductible, growth is tax-free, and withdrawals for qualified medical expenses are also tax-free. If you're still working and have a high-deductible health plan, maxing out your HSA can be one of the best ways to save for future healthcare costs. Assembling the right strategy can feel like an insurance puzzle. Beyond Medicare, you might consider supplemental insurance, also called Medigap or Medicare Advantage plans. These can help fill the gaps in original Medicare coverage, but they come with their own costs and trade-offs. Some retirees also look into long-term care insurance, though it's become increasingly expensive and harder to find. The key is to understand what's covered and what's not, so there are no surprises. To wrap things up, healthcare costs in retirement are one of the most predictable, unpredictable expenses. You don't know exactly what you'll need, but you know you'll need something. The best approach is to save aggressively, plan for more than you think you'll need, and consider health savings accounts as part of your strategy. This isn't meant to scare you, it's meant to help you plan properly. With proper planning, you can afford the healthcare you need without derailing your retirement. If this was helpful, hit that like button and drop a comment below. What's your biggest retirement healthcare question? I'd love to hear what's on your mind. And if you want more content like this, subscribe. I share exactly what I wish I knew so you can make smarter money moves.